Seniors, I am begging you to stop these 5 exercises that are slowly damaging your heart. This is not just a warning, it's a plea from a heart doctor who has seen too many people suffer silently. If you care about your health, if you want to live longer and stronger, you must watch this entire video. Inside, I'll reveal the 5 common workouts that might seem harmless, even good, but are actually putting your heart at serious risk. Knowing this information could be the difference between a healthy life and a life-changing emergency. Please don't scroll away, don't ignore the signs. Your heart deserves better. Watch carefully because these 5 exercises could be quietly hurting you every day. Stay with me to learn what they are and what you should do instead. 1. High-intensity interval training, HIIT, a heart specialist's perspective. Today, I want to talk about something very popular, high-intensity interval training, or HIIT. It's everywhere. On TV, social media, and gyms. The idea is simple: short bursts of intense exercise followed by rest, repeated several times. It promises fast results, improved fitness, and a stronger heart. Sounds tempting, right? But here's the truth from my years of experience as a heart specialist. HIIT is not always safe for older adults, especially those over 60. Our hearts change as we age. They don't respond to stress the same way they did when we were young. The heart muscle becomes more delicate, arteries stiffen, and the electrical system that controls heartbeats may become less reliable. Let me introduce you to a patient named Michael. Michael is 68, an active retiree who wanted to stay fit and keep up with his kids and grandkids. Inspired by online videos, he started attending HIIT classes at his gym. He enjoyed the challenge and felt proud pushing himself to the limit. One day, during a particularly intense session, Michael suddenly felt lightheaded and struggled to catch his breath. He had to stop and sit down. After visiting his doctor, he learned that the bursts of intense activity were causing dangerous spikes in his blood pressure and triggering irregular heart rhythms. His heart simply wasn't prepared for such sudden demands. Michael was shocked. He thought he was doing something good for his heart. Instead, he nearly put it at risk. This is a common story I hear. Many seniors don't realize that what works for younger people might be harmful to an aging heart, especially if there's high blood pressure, artery stiffness, or other hidden heart issues. Now let me ask you, have you ever tried HIIT or other high-intensity workouts? How do you feel during and after these sessions? Do you experience dizziness, chest discomfort, irregular heartbeat, or unusual fatigue? If the answer is yes, it may be time to rethink your exercise routine. Instead of intense bursts, consider gentler, heart-friendly activities like walking, tai chi, or swimming. These keep your cardiovascular system active without sudden shocks. Remember, true strength in your golden years comes from safety, consistency, and listening to your body, not pushing beyond what your heart can handle. 2. Core crunches and heavy lifting, when strength training can backfire on your heart. Today, let's dive deeper into a subject that's often misunderstood: strength training, especially core exercises like crunches and heavy lifting, and how, if done improperly or without care, they might inadvertently harm your heart. Strength training is widely recommended for seniors because it helps maintain muscle mass, bone density, balance, and overall mobility, all crucial to healthy aging. But there's a catch when it comes to certain types of exercises that increase intra-abdominal pressure and cause sudden spikes in blood pressure. The science behind the risk. When performing core crunches or heavy lifts, many people unconsciously perform the Valsalva maneuver, a forceful exhalation against a closed airway, like holding your breath while straining. This action sharply increases intrathoracic and intra-abdominal pressure. Research published in the Journal of Applied Physiology, 2001, explains that during the Valsalva maneuver, systolic blood pressure can rise dramatically, sometimes doubling for brief periods. For a healthy young adult, this spike is usually safe and transient. But in older adults, especially those with arterial stiffness, hypertension, or left ventricular hypertrophy, thickening of the heart muscle, this sudden pressure surge increases the risk of myocardial ischemia, reduced blood flow to the heart, arrhythmias, or even acute events like stroke. A 2015 study in Circulation demonstrated that blood pressure responses during resistance training could be substantial. and older adults with compromised cardiovascular systems should be cautious. Let me tell you about John, a 74-year-old man who experienced these dangers firsthand. John loved going to the gym and believed heavy lifting and intense core workouts were his secret to staying strong. One day, during a session of heavy dumbbell curls and crunches, John felt sudden chest pain, dizziness, and near fainting. At the hospital, cardiac monitoring revealed episodes of ventricular arrhythmias triggered during his intense exertion and breath holding. His cardiologist explained that the Valsalva maneuver during crunches and heavy lifts caused dangerous surges in his blood pressure and heart strain. John's case isn't unique. It's a cautionary tale many seniors face when unaware of how aging hearts respond differently to exertion. Questions to consider. When exercising, do you find yourself holding your breath during lifts or crunches? Have you noticed symptoms like dizziness, chest tightness, palpitations, or unusual fatigue during or after strength training? Are you aware of the importance of controlled breathing and pacing when lifting weights? If your answer is yes, it's essential to modify your approach. How to train safely without sacrificing strength. 1. Master proper breathing. Breathe out during exertion and inhale during relaxation. Avoid holding your breath. This helps maintain more stable blood pressure. 2. Opt for lower resistance. Instead of heavy dumbbells, use resistance bands or light weights that reduce excessive intra-abdominal pressure. 3. Slow, controlled movements. Rapid, jerky lifts cause abrupt cardiovascular stress. Slow down and focus on form to protect your heart. 4. Incorporate supervision. Working with a trainer or physical therapist who understands cardiac limitations is invaluable. 5. Monitor your body's signals. Stop immediately if you feel dizzy, chest discomfort, or palpitations. Additional medical insight. According to the American Heart Association, individuals with hypertension or existing heart disease should approach resistance training cautiously, as blood pressure spikes can exacerbate conditions. The AHA recommends moderate intensity strength training with controlled breathing and avoidance of breath holding to minimize risk. Moreover, a 2018 review in the European Journal of Preventive Cardiology suggests that while strength training benefits cardiovascular health, personalized programs considering individual cardiovascular status are critical. Remember, strength training is essential for healthy aging, but it must be done with care. Protect your heart by avoiding breath holding and heavy strain. Choose safer alternatives and listen to your body's signals. Your heart is your most valuable muscle. Treat it with the respect it deserves. 3. Exercising in extreme temperatures. When weather becomes your heart's hidden enemy. As a heart specialist who has witnessed countless cases, I want to share something often overlooked but critically important for seniors: the hidden dangers of exercising in extreme temperatures. Many think that simply moving more is always beneficial, but weather conditions can drastically change how your heart copes with exercise. Physiological impact of cold weather on the aging heart. When exposed to cold temperatures, the body initiates a series of protective responses to preserve core temperature. Blood vessels constrict, a process called vasoconstriction, to reduce heat loss. While this is natural, vasoconstriction significantly increases systemic vascular resistance. In simpler terms, your heart has to pump blood against a narrower, tighter network of blood vessels, increasing afterload, the pressure the heart must overcome to eject blood. Scientific studies, including research published in Hypertension, 2016, confirm that cold-induced vasoconstriction can elevate systolic blood pressure by 20-30 mmHg or more. For seniors with pre-existing hypertension or stiffened arteries, common in aging, this pressure spike can precipitate myocardial ischemia, reduced oxygen supply to heart muscle, arrhythmias, or even trigger heart attacks. Furthermore, cold air exposure stimulates the sympathetic nervous system, releasing catecholamines like adrenaline, which increase heart rate and contractility, adding more stress. Linda, a 70-year-old retired teacher, enjoyed her daily morning walk year-round. One icy winter morning, she ventured out wearing light clothing. After 20 minutes, she felt dizzy and short of breath. Emergency room tests revealed her blood pressure was dangerously elevated. and cardiac enzymes suggested mild myocardial injury due to oxygen deprivation. Linda's heart, already battling age-related arterial stiffness and borderline hypertension, could not cope with the added load caused by cold vasoconstriction and increased heart rate. The heat, an equally deadly challenge. Heat exposure triggers vasodilation, the widening of blood vessels, to dissipate heat via increased blood flow to the skin and sweating. While vasodilation lowers blood pressure, it also decreases the effective circulating blood volume due to fluid loss through sweat, causing hypovolemia. To compensate, the heart rate rises dramatically, a condition called tachycardia, to maintain adequate tissue perfusion. In older adults, these physiological shifts can quickly overwhelm a heart with diminished reserve. A study in Circulation, 2014, found that heat waves increase cardiovascular mortality, especially in seniors with heart failure or coronary artery disease. Heat in action, Robert's summer walk. Robert, 68, was a passionate gardener who insisted on walking during hot afternoons. He underestimated dehydration's effect. After several minutes, Robert felt weak and dizzy. His heart was pounding. He was rushed to hospital for heat exhaustion complicated by atrial fibrillation, an irregular heart rhythm. Reflective questions for you. How does your body react to exercise in extreme cold or heat? Do you adjust your activity or clothing depending on the weather? How vigilant are you about hydration during different seasons? Practical and safe strategies for seniors. Dress smart. Layer warmly in cold weather with moisture-wicking materials. Wear light, breathable fabrics during heat to allow sweat evaporation. Time it right. Avoid outdoor exercise during peak cold or hot hours. Early morning or late evening are best. Hydrate constantly. Seniors have blunted thirst sensation. Proactively drink water before, during, and after activity. Indoor alternatives. Use malls, gyms, or home exercises to avoid extreme outdoor conditions. Monitor symptoms. Dizziness, chest pain, palpitations, or unusual fatigue require immediate rest and medical evaluation. Why this matters: medical perspectives. The American Heart Association stresses that extreme temperatures exacerbate cardiovascular stress via complex mechanisms involving vascular tone, blood pressure regulation, fluid balance, and neurohormonal responses. For seniors, the diminished physiological adaptability means even mild weather extremes can tip the balance, resulting in acute cardiac events. Understanding these mechanisms is essential to crafting safe exercise routines tailored to aging. Hearts, 4. Jumping, rapid movements, and sudden direction changes, the hidden risks for an aging body. Today, I want to share an important and often overlooked aspect of senior fitness: the cardiovascular risks associated with jumping, rapid movements, and sudden changes in direction. While these dynamic exercises might seem like a fun way to stay active, they pose unique challenges to the aging heart and nervous system that are not always obvious. Why are these movements risky for seniors? As we age, profound physiological changes occur, especially within the cardiovascular and nervous systems. Arterial stiffness. With age, arteries lose their elasticity, a condition well documented in the Journal of the American College of Cardiology, 2015. This stiffening means that blood vessels cannot accommodate sudden surges in blood flow and pressure as efficiently as in youth, resulting in increased systolic blood pressure during exertion. Blunted baroreceptor reflex. Baroreceptors are specialized sensors in the arteries that detect blood pressure changes and initiate rapid autonomic adjustments. Studies, including one from Circulation Research, 2017, demonstrate that aging diminishes baroreflex sensitivity, impairing the body's ability to stabilize blood pressure during sudden posture or activity changes. Autonomic nervous system decline. The autonomic nervous system controls involuntary functions such as heart rate and vascular tone. Aging reduces its responsiveness, leading to slower cardiovascular adaptations and increasing arrhythmia risk during abrupt exertion. Vestibular and proprioceptive deterioration. Balance and spatial awareness decline with age, increasing fall risk during quick, uncoordinated movements. Research published in Neurobiology of Aging, 2018, confirms that proprioceptive loss contributes to instability, especially during rapid directional changes. When seniors engage in jumping jacks, burpees, or rapid lunges, these physiological limitations cause their cardiovascular system to face sudden, intense stress. Blood pressure spikes rapidly, heart rate fluctuates, and cerebral perfusion can be temporarily compromised, increasing risks of arrhythmias, syncope, fainting, and falls. Clinical evidence of risk. A landmark study published in European Heart Journal, 2020, analyzed elderly patients with heart conditions and found that episodes of ventricular arrhythmia were frequently triggered by sudden physical exertion involving rapid movements. The study emphasized the need for caution and tailored exercise prescriptions for seniors. Furthermore, a systematic review in Age and Aging, 2019, concluded that while physical activity benefits the elderly, high-impact and fast-paced exercises should be modified or avoided unless medically supervised. David, 67, a retired engineer, loved online fitness classes that included jumping and fast direction changes. Determined to stay fit and active, he pushed his limits. One day after a vigorous session, David experienced severe dizziness, irregular heartbeat, and nearly fell. Medical evaluation confirmed that the rapid, high-impact exercises overwhelmed his aging cardiovascular system, triggering arrhythmias and cerebral hypoperfusion. David's experience serves as a sobering reminder. Enthusiasm must be balanced with caution. Reflective questions. Have you experienced dizziness, palpitations, or balance loss after rapid movements? Do you consciously slow down or modify your exercises when feeling unsteady? Does your current workout routine include exercises to improve balance and coordination? Safer alternatives to protect heart and body. 1. Tai Chi and Qigong. Multiple RCTs, randomized controlled trials, published in BMC Complementary Medicine and Therapies, 2019, show these slow, meditative movement forms improve balance, reduce blood pressure, and stabilize heart rhythms in seniors. 2. Water-based exercise. The hydrostatic pressure reduces joint load while enhancing venous return and cardiovascular efficiency. A meta-analysis in Sports Medicine, 2017, supports water exercise as safe and beneficial for elderly cardiovascular health. 3. Balance and flexibility training. Exercises targeting proprioception, such as single-leg stands or gentle yoga, decrease fall risk and indirectly protect the heart by preventing injury-related deconditioning. According to the American College of Sports Medicine, ACSM, and the American Heart Association, AHA, exercise programs for older adults should emphasize functional fitness, improving strength, balance, and mobility necessary for daily living, while avoiding rapid, high-impact movements unless cleared and supervised by medical professionals. Personalized, medically informed exercise plans ensure maximum benefit and minimal risk, especially for those with existing cardiac or neurological conditions. 5. Exercising too late at night, when good intentions disrupt your heart's healing. Tonight, I want to address a subtle but crucial aspect of heart health that many seniors unintentionally overlook: exercising too late at night and how it can interfere with your heart's most vital time, the time it needs to heal and regenerate during sleep. We all know exercise is essential for longevity and cardiovascular health. But did you know the timing of your workout matters just as much as the exercise itself? For seniors balancing busy schedules, family obligations, or simply trying to squeeze activity into the day, evening or late-night workouts may seem like a convenient option. However, scientific evidence warns us that exercising too close to bedtime can disrupt your body's natural rhythms and undermine heart health in ways you might not expect. Understanding circadian rhythms and cardiovascular function. Your body follows an internal clock, known as the circadian rhythm, that regulates many physiological processes including hormone secretion, blood pressure, heart rate variability, and metabolism. According to a study published in the Journal of Clinical Sleep Medicine, 2017, vigorous exercise too close to bedtime raises core body temperature and stimulates the sympathetic nervous system, the system responsible for the fight or flight response. This leads to elevated levels of adrenaline and cortisol, hormones that promote alertness and wakefulness. This stimulation delays the transition into slow-wave sleep, deep sleep, and REM sleep, stages critical for cardiovascular repair, reduction of inflammation, and normalization of blood pressure. Poor or fragmented sleep leads to persistent activation of stress pathways, higher blood pressure, and increased risk of arrhythmias, insulin resistance, and systemic inflammation. The impact of poor sleep on heart health in seniors. Research consistently shows that inadequate or disrupted sleep is strongly linked to higher incidence of hypertension, increased risk of stroke and myocardial infarction, greater likelihood of heart failure progression, elevated systemic inflammation, contributing to atherosclerosis. A large-scale cohort study published in Sleep, 2019, found that older adults exercising within 2 hours of bedtime were significantly more likely to report poor sleep quality, daytime fatigue, and increased cardiovascular events compared to those exercising earlier in the day. Mary, 72, is a retired librarian who valued staying active despite a busy daily routine. She began incorporating light cardio and stretching routines late in the evening, often as late as 9:30 or 10 p.m. Over several weeks, Mary noticed difficulty falling asleep, frequent nighttime awakenings, and poor concentration during the day. Her blood pressure readings showed an upward trend, and she experienced occasional palpitations. After consulting her cardiologist, Mary was surprised to learn that her late-night exercise was disrupting her sleep architecture and preventing her heart from getting the rest it desperately needed to recover. By shifting her workouts to morning and early afternoon, and using calming activities like yoga in the evening, Mary experienced marked improvement in sleep quality, blood pressure control, and overall vitality. Interactive questions to reflect on. Do you currently exercise late at night? How soon before bedtime? Have you noticed sleep difficulties or heart palpitations after evening workouts? Could you try shifting your workouts to earlier in the day and observe how it affects your sleep and heart health? Practical recommendations for heart-friendly exercise timing. 1. Complete your workout at least 3 hours before bedtime to allow your body to wind down naturally. 2. Choose gentle, restorative activities like stretching or meditation in the evening to prepare your body for sleep. 3. Prioritize morning or early afternoon workouts, which align better with your circadian rhythms and promote better sleep. 4. Create a relaxing bedtime routine. Dim lights, avoid blue light screens, and practice deep breathing or mindfulness to ease into restful sleep. 5. Track your sleep patterns and cardiovascular symptoms, and discuss any concerns with your healthcare provider. The American Heart Association emphasizes that sleep is when your heart heals and restores itself. Disruptions in sleep, whether from stress, lifestyle, or late-night activity, can increase the risk of heart disease progression. A 2020 review in Frontiers in Physiology stresses the importance of synchronizing exercise, timing with circadian rhythms to maximize cardiovascular benefits and reduce adverse outcomes, particularly in older adults. Thank you for staying with me through this important message. Remember, your heart is the most precious gift you have. It beats tirelessly for you every single day. Those 5 exercises I asked you to stop, they may seem harmless or even beneficial, but for an aging heart, they can quietly cause serious harm. This isn't about giving up on movement or strength, it's about moving smarter, safer, and with respect for your body's needs. Choose exercises that protect and nourish your heart. Walk gently, breathe deeply, and listen closely to your body's signals. You are never too old to make better choices. It's never too late to protect your heart and live your best life. Please share this video with someone you care about, because everyone deserves a strong, healthy heart. If you found this video helpful, hit the like button, subscribe for more heart health tips, and leave a comment sharing which exercise you will stop or what new habit you will try. Take care of your heart, it's your lifelong companion. I'm rooting for your health and happiness every step of the way.